Eric Rice. He's the CEO of Data Registry Services, and he, with his able partner, Michelle Hackberry, have been working very hard to get the ability to provide your data and give good information to individuals who are not seen at centers that are working within the registry. And he's been doing that for lots of years now. How long has it been, Eric, that you've been doing this?
I think it's been about 5 years now.
About 5 years now. So it's a great service and a good thing. And also his mother was one of my mentors coming into Fabry disease. So it's like a family affair. Eric has been working hard in the rare disease space for many years now. Your turn, Eric.
All right, let me see if I can do this correctly. I'm gonna share my screen. All right. Well, thank you, Dawn, for that introduction. That's great. Excited to be here. Jerry, very excited to see you doing well. And scrolling through the participants here, it's nice to see lots of familiar names and faces. So thanks again for having us. I believe we've been with the NFDF conference now for 4 or 5 years in a row, and it's always a great weekend. And continuing it virtually is a great way to go this year. So I'll jump right in here. This isn't going to be terribly long, and it's something a lot of you already know a little bit about, or a lot about. It's the Fabry Registry. We are Data Registry Services, so we are a single site of many in the Fabry Registry, and ours is just a little bit different than others, and I'll talk about that shortly. My name is Eric Rice, and let's get rolling. Maybe. If I can get it to... Yeah.
Maybe click your mouse on the slide, see if that does it.
Yeah, there we go. Perfect. Thank you. All right, so what is the Fabry Registry? The Fabry Registry, it's an ongoing observational study. And the goal of it is to help to understand the variability and progression of Fabry disease. It's sponsored by Sanofi Genzyme, so they maintain the registry and sponsor it, cover the costs of it. And in general, the idea is to help researchers with the understanding of Fabry in an effort to come out with much better long-term outcomes and improvements in quality of life for patients moving forward. So again, like I said, it's observational only. So it is basically a bunch of data being aggregated into one site. That data is de-identified when it's put into the site, and then that data is made available to the researchers to conduct studies and look at improving patient outcomes with Fabry disease. Some interesting facts about it. There are about 7,500 participants globally, so it is all around the world. As I mentioned, it's totally voluntary and it's totally confidential. So as a patient, when your physician or your registry site provider looks at your data, it becomes de-identified before they enter it into the registry, and they take that very seriously. So the confidentiality of the data is very important to the registry. Anybody with a confirmed Fabry diagnosis is eligible to participate. You don't have to be on treatment. You don't have to be on a Sanofi Genzyme treatment. And information obtained is again used to create those better management of the disease and better outcomes in Fabry disease. Effectively, the way it works is there's a board of medical advisors that sits down just about annually and comes up with a recommended schedule of assessments. And these are the specific data points that they've determined to be the most important. And those are the data points that they're asking the sites, of which we are one, to get the information from the patient health records, de-identify it and enter it into the site, into the registry site. As I mentioned, there's hundreds of individual registry sites all across the country. And the data is then aggregated and managed and organized by the actual official kind of Fabry registry staff that works for Sanofi Genzyme. The Fabry Registry then, with that aggregated and cleaned data, provides that data to scientists and researchers so they can do research and study and again come up with those better management and outcomes for patients in the long run. Again, kind of scrolling through the feed of folks that are in this conference. I know that some of you are already participating in the registry, some of you even participating through us, so that's great. We love to see that. And others may or may not know what the registry is. I think a lot of you do, but if you don't, or if you're unsure of your status, that's one of the main things we do at the NFDF conference is help people to just reconnect with the registry, understand whether or not they are enrolled. A lot of folks have been enrolled for a long time. It's not a heavy lift in terms of what you have to do on an individual basis, on an annual basis, so you may not remember if you're enrolled. We're happy to help you out and check your status and then report back to you on that. And I'll give you some opportunities to do that, I think, coming up right here. So a couple of easy ways to do that. So it's just like walking up to our table at the conference. If you've been there in the past, this year we're doing it virtually. So we set up a little web page. There's a quick form you can fill out. You can do this on your cell phone. You can do this on your laptop. It's just dataregistryservices.com/Fabry. There's a note on there for a couple of basic pieces of information that you can provide us. And then we've got a call with our registry contact tomorrow. We'll assess whether or not you're participating and circle back with you and let you know, probably by tomorrow afternoon. So pretty quick turnaround on that and very easy to do. Alternately, you can come meet with us in our Zoom room this evening. I know that the NFDF provided information to everybody as to how to access those various Zoom rooms. So you can find us in the Data Registry Services Zoom room this evening. We'd be happy to chat in more detail about what the Fabry Registry is and whether or not you're interested in potentially participating. So come see us tonight. We'd love to see some folks in there. Just a little bit about us as a company, Data Registry Services. We are a single registry site. We're not a separate registry. We get that question a lot. So we're part of the larger Sanofi Genzyme sponsored Fabry Registry. This is not an individual registry. We're an independent small company. Michelle Hackenberry and I, along with Dr. Joseph, started this site 5 years ago or so, and in an effort to allow patients that are interested in participating and sharing their information with the registry, but may or may not be seen at one of the larger sites that has the capability to participate in the registry. It is a good bit of work, and not every physician's office has the capacity to handle that. So we try to fill a void that we saw, which was just patients that were interested, excited about it, wanted to share and be collaborative, but didn't have the opportunity because their physician wasn't able to offer the service. So because of that, we set up in a remote way. So we kind of were already COVID compliant coming into this, just based on the way that we work. It's all remote because we're working with patients all across the United States. We pull in the data on our end, and we've been able to enroll lots and lots of patients in the registry, and help to get that valuable data to the researchers and scientists that are using it to study and come up with better care options. So one thing we do too, we focus, it's all we do. So we're not treating patients. All we do is collect the data, aggregate it, and enter it into the registry. So we really do make a significant effort to make sure we're collecting longitudinal data and complete data sets, because that's the most valuable for the researchers that are utilizing this data for studies. So we go back and try to collect as complete a record as possible, which is something that we take a lot of pride in. Michelle is the ace when it comes to that. So lots of kudos to her. And many of you know her too, obviously. So it's very simple to get signed up if you're not already signed up. There's a pretty short consent package that we can review with you virtually via Zoom or over a phone call. Michelle sends that out to any interested patient. You sign it, send it back. We then are able to jump in and reach out to your physicians, current and past, and any other institutions that you've been seen at. Bring in all that data on our end. We digitize it, and then we have HIPAA compliant, secure storage in the cloud that we utilize to store all that data. One of the great things about it that we've had several patients take advantage of is, after we've done all that collection, we kind of have a folder for you, basically, of all of your medical records, and they're all in one place. It's very easy for us to jump in, pull them up for a patient that's at our site. If you want them for your own personal records, or if you're moving physicians and you want to take a nice file of all your records to them, we can give you a digital copy of those. We can print out a copy for you to have, whatever you like. It's, obviously there's no charge for that. There's very little ongoing work on the patient's end. There are a couple of health surveys that get filled out each year. They come in the mail. There's a prepaid postage envelope in there, so you can fill them out at home, pop them back in the mail. They come back to us, and Michelle enters that information. So she makes it very easy. It's a very light lift on your end, and again, you end up with all your records in one place if you want them in the future. A couple of fun facts about our little site. We work with 113 Fabry patients all across North America currently. So we've got patients in 33 states, including Alaska, which is kind of fun to think about where everybody is. And even in 2020, most of the records that we receive come in via fax or snail mail in an old-fashioned envelope. So despite everything being digitized, there's not a lot of digital sending of records at this point. And so we end up with stacks and stacks and stacks of records that we have to kind of digitize page by page. So it seems funny in 2020 that that's the way that it works, but it is. And we're happy to do it. So really the main thing I kind of want anybody that's on the call here today to take home from this is just that the Fabry Registry is really an important thing to be a part of if you're able to and if you're willing to. It's voluntary. But the research, the data really is used for good research, and it's very helpful for kind of the current and future patients with Fabry disease. There's been a lot of great studies that have come out of the registry, and we feel very strongly that there'll be more to come in the future. So it's a great resource. It's very little work on the patient end, and we try to make it as easy as possible. So if you are a patient that's interested in learning more about the registry, wants to check your status, or is ready to sign up for the registry, and you don't have that option at your current treating physician's office, we are happy to get you signed up. If you end up moving to a site that actually is an active Fabry Registry site, we're always happy to transfer you over to your treating physician so that they can continue entering your registry data. Our goal really as the small company that we are is just to kind of bring about more awareness of the Fabry Registry and try to get as many people enrolled as possible, just to help with the long-term management and treatment options for patients with Fabry. So that's it. It's short and sweet. If anybody has any questions, feel free to ask them now, or come see us in the Zoom room tonight from 6:30 to 8:30. Also, you can jump on the website, fill out that little form, and we can check your status. So thanks so much for the time. Thanks, Don.
Thanks, Eric.